If you're looking to lose weight, you've probably heard of the popular class of weight loss drugs called GLP-1s. Semaglutide's a popular one right now. This medication class has proven to be a great solution for long-term weight loss, but there are a few things to keep in mind while taking them. Hi everyone, my name is Dr. Katrina Mattingly, and I am a board-certified obesity medicine doctor and Chief Medical Officer at Options Medical Weight Loss. The first thing to avoid while taking GLP-1 is high-fat foods. Foods high in fat like dairy products, pizza, cheeseburgers, fried foods, or even ice cream can cause unpleasant stomach upset. Typically when our stomachs are upset, our digestive systems can process the food quickly, and although unpleasant while it's passing through the gut and out of the GI tract, it gives us relief. GLP-1 medications delay your gastric emptying to help you feel fuller longer, which means these foods will spend even more time in your gut. This can be irritating to the GI tract as well, causing, again, GI upset. The number 2 thing to avoid, high sugar foods. High sugar foods are not only unhealthy and inflammatory for your body, but will spike your blood sugar and potentially prolong your weight loss journey. Decreasing or avoiding things like soda, pastries, and candies to avoid further stomach upset will allow the medications to work most effectively. Here's another one, 3. Alcohol. It's important to talk to your doctor candidly about your relationship with alcohol when taking any prescription medication. Alcohol will not only irritate your stomach, potentially causing further inflammation, but it can also increase your risk of developing low blood sugar, or what we call hypoglycemia, while on GLP-1, since both alcohol and GLP-1s can drop your blood sugar. The last thing we're going to talk about avoiding is overly processed or refined grains. While I know they taste oh so good, processed breads or refined grains can cause frustrating symptoms like constipation and high blood sugar. Additionally, these foods don't offer a lot of nutritional value and are typically low in fiber and another source of empty calories. As always, talk to your doctor about your diet and lifestyle when choosing a GLP-1 medication to determine which one is right for you. If you have further questions, need more information, or are interested in GLP-1s, don't hesitate to reach out to us. We have options for everybody.
Did you like this video? Like, subscribe, and ring that notification bell so you can stay up to date on our latest videos. You can also visit our website using the link below to schedule a free consultation with us. We have options for everybody.